All right, I think we're just about ready to get going again. Matthew, did you do 50 more burpees in the break?
I did. I
Okay,
did.
good, good.
They're
Um,
critical to sustaining me.
I think I drank another gallon of coffee. Okay, so we are going to now move into the meat and potatoes of the workshop today, where we're going to hear from the work group chairs on some of the conversations that have been happening over the past couple of weeks. And then there's going to be some time for feedback and dialogue. So Matthew, can you walk us through how this is going to work?
Yeah, so just real quick, let me just build on what you said. So in our first hour together, the goal was to level set what brought us here, the foundation our work is building upon, look at the available data, what coalition stakeholders are thinking we should prioritize, and what can we learn from other states who've established coalitions. Now we'll be doing a deeper dive, as Will said, using the National Water Safety Plan framework to look into the key aspects of water safety and what our work groups have done to identify the gaps, goals, and activities. And this is output from multiple rich, multi-perspectival conversations and planning by the work groups that are comprised of subject matter experts. So this now is the opportunity to hear that output and hear other people's, this is most critical, other people's perspectives on that, and critically, those people who are not part of the work group. So really looking forward to this dialogue. Will, if you go to, yeah, perfect. So what we're gonna do is each work group has 10 minutes to report out, and then we have 8 minutes of Q&A that can come from the audience. This is an opportunity for dialogue and discussion and to provide feedback on what may be missing, things to consider anew or differently, etc. And bear with us as we facilitate that conversation, which involves a little bit of the technology, which Will speak to now. But then after Will does that, we'll go directly to the water safety and water competence group first, since I believe there's a schedule adjustment that requires it. Will, okay. Over to you.
Just on that note, Nicole and Dan, if you guys are ready to go now, just can you say yes or no in the chat? While we do that, as far as Zoom logistics, it is too complicated to have everybody in the same room at the same time because we've got 50 plus people here. So as you hear the working group report out, what we want to facilitate in terms of dialogue and feedback is a really rich discussion in the chat, some specific questions in the Q&A, and then after in that 8-minute session, there's going to be an opportunity for you to raise your hand, and then we can actually unmute your microphone and you can make a comment and we can facilitate that. So again, thanks for your grace as we figure out how this goes. And Matthew, I think before we jump in, there is a rules of the road slide. So rules of the road.
Yeah, so just very quickly, I think everyone appreciates these. So I'd encourage us to focus on the big picture. What's our common purpose of, which is keeping people safe in water. We want to be sort of forward-looking, keeping the future in mind, supporting the creation of an initial set of priorities, which will evolve over time. This is not a platform to seek out one's own priorities or to settle previous disputes. Bring to this a spirit of collegiality and collaboration, no criticizing or complaining, please. And we ask that people stay on point, you know, so land the plane, as it were. And then, of course, we more generally have a commitment that the work should be guided by the science and evidence where and when we have it. And so ever mindful of the data question that cuts across all of these issues. So I guess we're ready. I'm seeing Dan has said he's ready. So let's go with Dan. Does that work?
That works. Okay, so I'm gonna get both Dan and Nicole in. And then I am going to go find, if you just bear with me 1 minute. I am going to go find the water competency slides. Here we go. And then, excuse me, Aaron, will come to you next for data. So I think Dan, let's see. Yep, there you go. Okay, awesome. Nicole and Dan, rock stars of swimming lesson and water competency working group. Take it away, you guys.
Awesome. Thank you so much for having me. Can you hear me okay, Will?
Yes.
Awesome. Okay, so I'm going to run through quickly the gaps that the group determined, as well as the goals that we have as a group. I'll jump into some action steps, and I'll let Nicole finish off the action steps. So with regards to the gaps that we found within the group, one was messaging, and the fact that community members were really unaware of the risks around water and the importance of participating in swim lessons and water competency and so on and so forth. Gap number two is access. So community members having access to swim lessons, to swim programs, and the fact that low socioeconomic status really had a large impact in the access. And then lastly, bridging the gap, really taking it from swim lessons in a pool in an organized fashion out to the ocean or waterfronts, lakes, where all of a sudden, this came up a couple times, but all of a sudden they're being introduced to very, very cold water in a less controlled environment, and everything you think you knew goes right out the window. With regards to the goals, on messaging, it's raising awareness through consistent coordinated messaging, teaching community members about the necessity of the water competency skills. With regards to access, there's increasing access to lessons and programs, and something that we can replicate and build out at a larger scale. And then with regards to bridging the gap, it was introducing more individuals to open water activities in different ways that we can do that. So graduating them from pool lessons to junior lifeguard programs and so on and so forth. Now, as far as the action steps are concerned, one of the biggest ones that we were all very, very excited about is this idea of a centralized hub, so to speak, quote unquote hub, that hosts information for all individuals, that gives people information on where to find swim lessons, what's important about water safety, one central home where all California residents and eventually everyone can go to find out what they need to know and where they need to go to learn more. And the last one that I'll cover, and then I'll turn it over to Nicole, is developing a self-certification process for swim lesson providers. So almost a vetting process that we can get people, as soon as they're listed on the hub, they've gone through some kind of self-certification that we know that they know child development to some degree, they know water safety to some degree, they know, again, we're not teaching them how to teach swimming, but some kind of vetting process that allows the people going to the site to know that the people they're reading about or learning about or being directed to actually know what they're talking about. So for the other action steps, I'm going to turn it over to Nicole.
Okay, right on. Thank you. All right, so just to tag on that with that self-certification and vetting process, we're very interested in ensuring that we can provide information to the community for programs that are focused on water competency. Rather than just getting in the pool and having fun, we want to make sure that we're pushing out information around water competency. And the hub is also going to help us, hopefully, with access. As we know, access can be a barrier. The cost of swimming lessons is absolutely a barrier. There are cultural barriers. So if parents didn't learn how to swim as a child, it's probable that they may not introduce their children to swimming lessons and aquatic activities, and then the cycle continues. So we want to increase the access. And one of the ways that we can do that, an action step, is by coordinating programs, for example, through schools and partnerships. They may not come to the pool on their own with their family, but if they can come as a group with a church group or a nonprofit or through school, we have a way to provide access to kids. So we absolutely want to identify what's already happening. There's some awesome things happening throughout California. And we chose an action step of highlighting these programs in the hopes that we can potentially replicate and amplify what's already happening, these awesome programs. Unfortunately, another barrier has to do with lifeguards. There are not a sufficient amount of lifeguards and specifically swim instructors. And the lifeguard shortage is a national shortage. And we'd be amiss to not talk about this, that unfortunately there's a big barrier. If someone walks into, say, a YMCA or a municipality and requests swimming lessons, they may be turned away at the door just because there are no staff. So many pools have depended on teenagers for many years to serve as swim instructors. And the reality is there are just not as many teenagers who are working today. Back, 20 years ago, about 50% of teenagers worked. Now, according to the US Bureau of Labor Statistics, it's about 35%. So over the years, as there's less staff and less swimming lesson programs happening, there are less people who are prepared to become a swim instructor. So we do have an opportunity here, absolutely, to engage an older demographic to come in and serve as swimming lesson instructors. And that's why we feel a great action step would be to design a marketing campaign that can target multiple generations, including our senior citizens, to increase the number of trained instructors that we have throughout the state. So just to recap, we want to highlight and identify programs, school programs, and partnerships. We also want to highlight and identify programs that happen on or around natural bodies of water. And the reason for this, we feel that there is a gap between the water competency skills within pools and moving out into open bodies of water. They're just not progressing to open bodies of water. So in order to do that, our goal is to introduce more individuals to open water activities that incorporate safety education and water competency. So there are some amazing programs that are happening. There are junior lifeguard programs, there are Bridge to the Beach programs, there are swimming lessons and water competency programs happening in open bodies of water. So again, we want to identify these programs so that we can potentially serve to amplify and replicate these programs in other areas. And all of these programs would be on this centralized hub so that we could share. Okay.
Excellent. Well done. Thank you, Nicole and Dan. That's really, really rich. Will, did you want to tee up, see if there's any questions from the group, any comments?
Sure. So please kind of make your comments in the chat. And if you want to speak up, you can use the raise your hand feature and I can unmute you. And I would just ask before we jump in, Nicole or Dan, as a non-swim instructor person, when I first heard the term water competence, I didn't know what that meant. Could you give us a quick snapshot of that? And then I also want to prime for our discussion maybe in a little bit, the ocean lifeguards in the group who are listening, who have junior lifeguard programs. How do you see junior lifeguards potentially integrating with this? So can we define what we mean by water competency?
Sure. So there are different definitions of water competency, but just to kind of break it down, it's basically skills that one would have that could save their life in an aquatic situation. And it's also skills to save other people. So just to provide an example, when we teach swimming lessons, there is, say, a water competency sequence, an example of that of the Red Cross, where if one is familiar or can complete the water competency sequence, they can jump into a pool, tread water, float on their front or back, for 30 seconds, swim 25 yards across, say, a pool, and then be able to exit independently. So those are skills, for example, that we would want to happen in a swimming lesson. And as far as the junior lifeguard programs, are they able to use those skills in the ocean? Because the ocean is a different environment. I mean, it could be cold, it could have, different, whether it's waves or whatever it is. It's just really knowing your surroundings and knowing what's happening, knowing what the hazards are, and doing what it takes to stay safe. And in the event of emergency, how would you respond and help others?
Yeah, and I will also add that when we talked about the self-assessment in the hub, a lot of what we talked about in our working group was that those self-assessments would ensure that whoever is approved to be listed on the hub is actually hitting those competency goals that the group will eventually settle on, right? So it can't be I'm teaching one thing and someone else is teaching something completely else, something completely different. By going through the self-assessment, by going through this almost certification to be listed on the hub, they're acknowledging that their curriculum includes these base level water competency skills that every child is learning. And then as we think about bridging that gap, as these kids start here, and then they move into junior guards, and we really develop quote unquote cool programs for the kids as they go out and become educators and become junior lifeguard instructors or swim instructors. We're building in this incredible workforce that will eventually, like we see overseas in Australia and other places, that teaching swimming, becoming a lifeguard, so on and so forth, are career decisions, and there are opportunities for them to continue in past, especially on the swim side, past high school, past college. It's something they can make a career out of.
So it's super helpful. I have dropped into the chat Dr. Simonian asked, is there an agreed upon definition of water competency? And there's a lot of terminology that's thrown around there. I've dropped into the chat the Red Cross description, which is pretty good. I think it outlines, like, Nicole, 10 or 11 kind of steps or something like that. We also have Julie in the chat making some comments about, trying to engage that elder workforce, and something that came up in the work group, in this work group, but also I think in the lifeguard and supervision work group, was how to go about recruiting. And this is something that I think our voices together, are going to be louder than all of us individually shouting into the void. And so this is potentially another area that we can collectively have some action. Kim wants to make a comment or ask a question. So Kim, I'm going to allow you to talk. You can unmute now and comment. Go ahead.
Hi, this is Kim Schultz from San Diego. I love where you're going with this already. Targeting that older demographic for swim instruction just seems like such the perfect pivot right now, just with the people retiring and early retiring and looking for things to do. But also, I teach a lot of adults that have a lot of fear, and my number one thing that I hear is that they go and they get a teenager that goes to teach them, and they just don't have the empathy or the compassion to do that effectively. And I think that the older adults will really be able to do that. So I love where you're going with that. My question is, how are you're talking about marketing to the older adult and having them be trained. Are you looking at creating a training program for that? Are you looking at anyone that's doing water competency sequence would be training that? Or I'm interested in that. So I'm just interested in where that's going.
Dan and Nicole, this is Matthew. I'm just jumping in to say we're running a little short on time. So if you keep your answers brief so we can keep going. But I also just want to note that Phyllis's question as well, and John Moore has also made a comment here, but go ahead.
Okay, awesome. So I will try to quickly address. So yes, it's, a super exciting opportunity to engage an older demographic and seniors. We need you. And so, it would be awesome if this group can work to engage more seniors throughout the state, wherever they work, wherever, whatever entity, whatever city, YMCA, swim school, whatever it is. And that's where they would go ahead and get their certification. But what I'm finding, because I'm in San Diego, and so we've been working hard the past couple of years to engage seniors. But the challenge is seniors may not have the physical capabilities to meet the lifeguard training requirements. So it may be in our best interest as a group to help encourage entities to create that specific swim instructor role or job title, so that we can engage more older adults. There's so much value to creating a multi-generational work environment where they would, serve as a role model and example for younger staff that they work with. And I mean, we're right, looking at in the chat, Julie, like we have so many seniors that are young, they're fit. I mean, these are the people that are coming to our pools and swimming laps and doing water fitness. They're already there. They have the energy and they want to give back and they want to serve the community. So it's a huge, huge opportunity there. And I think we can work together as a group to determine how we're going to go ahead and market and develop a campaign. Okay, and then I want to go ahead and check the chat. I need to address additional questions in here.
I'll just jump in. Nicole and Dan, if you could kind of address some of those issues in the chat. We need to move on for time, but I want to let everybody know the whole purpose of this is just to like skim the surface, because tomorrow at 10 a.m. we are going to have kind of an open session where lots of your questions and discussion can come out. And in that session, we won't be in a webinar. We're going to be in a Zoom meeting. So it'll be a little bit easier to facilitate. So I am going to say thank you to Dan and Nicole. And if you guys wouldn't mind continuing that on in the chat, and we are going to move on to Aaron from Riverside, who is going to do some data. So I think, have I shared the right screen? Yes. Matthew, are we good? Can we move on to?
Yeah, we're good. We'll keep rolling. Yep.
Okay, Aaron, you're one of my heroes along with Dan and Nicole. Aaron, can you just introduce yourself for the group and then get us going on what the data group has been chatting about?
Okay, how's my volume? How's my video? Is it on?
Yep, you're perfect.
Okay, so I'm Erin Malone, and I'm a program coordinator with Riverside University Health System Public Health. So I'm going to report out just for timing so we know where we're at for the next about 10 minutes. So we know drowning is a leading cause of preventable death. However, there is a lot that we don't know. And so I thought I would start with a twist on what we do know. So we know that the data we have on drowning is suboptimal. We know there's a lack of quality data around this under-recognized public health issue. We do not have a statewide tracking system for drowning incidents. And we know to change this, data collection or evaluation needs to be improved and in some cases established. So in preparation for today's presentation, our work group met 3 times over the past 4 weeks, and we were asked to prioritize those gaps and present our data public health surveillance. So, we're always learning, and we shared a lot of information. After prioritizing the gaps, we discussed a few goals and action steps. So I'm not going to be presenting anything groundbreaking. We all know that there's data issues, but what I do think is novel is that, over the next week, we have already committed ourselves to these dedicated discussions or office hours that we're calling it. So we have some scheduled tomorrow, Thursday, Monday, and then we're going to be back here on Tuesday. So next week, our work group, we are going to present again our gaps, our goals, our action steps, but I know, and it should look different, and it should be shaped by our discussions over this next week. So we do welcome and encourage active engagement over the next week, and we're excited to return 1 week from today to present again. So let me start with the 5 gaps that we feel are present. So gap number 1, current data collection, it remains fragmented, and it comes from a variety of sources. So for example, our sources include lifeguards, police, fire, EMS, hospitals, and coroner reports. Unfortunately, these sources are not talking to each other, which limits our ability to really understand the problem. So with this fragmentation, we see inconsistency in numbers, and we see undercounting. Gap 2, data is incomplete or inconsistent. Data from the various sources I mentioned is collected without a standardized protocol or reporting tool. There is no uniform system or surveillance tool for tracking data on drowning using common variables. So when we say data is incomplete, I'm referring to missing data fields like demographics, location, circumstances. We need reliable and sufficient data to understand the problem to ensure that our prevention efforts are informed and most effective. So in terms of inconsistency, we have to ask, what do we mean by drowning? What is a rescue? When should a report be filled out? We must encourage the collection of uniform variables to best inform our prevention. So something as fundamental as the definition of drowning itself varies among sources and reports, as do clinical characteristics of outcome measures. We need clarity on definitions. When we review existing reports and data sources, there is a lack of standardized definitions. We have uniform definitions that have been proposed by the World Health Organization, the CDC, and others, but they are not always used. Terminology is important, but we do note that it is complicated. This lack of consistency makes assessment and analysis very difficult. Gap number 3, we need to improve the sharing and the use of data. So while we work to collect this important data, we need to improve the ways that we share it so that it can be used appropriately to inform actions. Some data owners are reporting consistently, others are not. We must promote joint collaborative use. So how can we harness what we do have and use it to inform? Example would be a local county collects data. So for example, my county, we collect data. But what's the next step? Where is that data going? What data points do we have now that we can act on? What data can we currently use to decrease drowning? We need to invest in the goals of improving collaboration and coordination efforts, from research to knowledge transfer to practice. Gap number 4, there's a need for more evidence on effective interventions. So effective strategies to reduce injuries require comprehensive research and a variety of evidence-informed approaches to intervention. So understanding drowning circumstances allows researchers to identify those risk factors for drowning, which in turn improves understanding of the possible preventive actions. So we acknowledge that research is difficult and expensive, and it takes real expertise. We need more applied evaluation studies. Gap number 5, we need long-term research agenda and incremental implementation of prevention strategies at all levels of the spectrum of prevention. So research remains a cornerstone of evidence-based decision in health. We need to coordinate and try to link data sources, pilot intervention studies. Few studies have evaluated the results of attempted resuscitation from drowning, starting at the scene of the drowning and continuing through hospital admission, hospital discharge, and then the long-term follow-up. So in fact, most studies of drowning outcomes have been hospital-based and have not evaluated events at the scene or care given the victim before admission to the hospital. So closing gaps is vital to reduce loss of life for those impacted by drowning. The World Health Organization has called for improvements in drowning data collection as one of the range of strategies aimed at preventing drowning. We recognize, again, this will cost money and require improvements at a systems level. Next slide, please. So good data is a challenge across the globe on all health issues. Work undertaken to date on fatal drowning data must also be replicated for non-fatal drowning. So multi-sectoral collaboration will be required to progress data collection on both fatal and non-fatal drowning, and a range of risk factors. So aquatic location, activity, social determinants of health, alcohol, pre-existing medical conditions. So you'll see at the top, our dream or ultimate goal for our work group is a statewide registry or tracking system. So this registry would provide data for state and local practitioners and policymakers to effectively design and implement prevention and intervention programs and policies to successfully and substantially reduce drowning incidents. Our work group defined shorter and longer term goal, as well as some action steps to achieve these goals. So for our shorter term goal, we recognize the value of providing supports to local groups that are collecting and using data. We recognize better data is required at a local level to help with the development, targeting, communication, and evaluation of drowning prevention initiatives. So better drowning data has several elements. The data needs to be captured, it needs to be timely, accurate, consistent, and detailed, covering all drowning deaths, not just those covered by the ICD codes. And of course, be usable and available to drowning prevention organizations. So data collection is happening in California, but do we know who exactly is collecting data at a local level? No. Our recommended action is to determine who is collecting data. We want to determine what data are needed by the work groups presenting today so that we can improve their effectiveness. We want to assess what support is needed by those collecting data or even those that are interested in collecting data. For example, do programs need evaluation support? If that's the case, our work group discussed hosting evaluation seminars as an example. In the longer term, we see value establishing and implementing a long-term research agenda. So for example, a pilot project focused on uniform data collection points among counties, developing a report template for counties interested in collecting data, learning more about EMSA and the efforts to use census data. So for example, it is critical to collect data from the scene. What is EMSA already collecting? And is there scope to access, or is there room for improvement? Most resuscitations begin at the scene of the drowning and not at the hospital. So making on-scene data is extremely important to collect. Furthermore, many or possibly most drowning victims have mild symptoms, recover at the scene, and may or may not be transported to the hospital. So to have a complete understanding of drowning and to capture the full scope of the problem, it's crucial that data at the scene be included in drowning reports. And then final action, investigate potential of linking and coordinating the use of multiple data sources. So we do have some great work happening throughout California. Throughout our state, we are collecting data, some of us individually at an agency level, a city level, a county level. There's some programs collecting data and conducting some research. We have some programs thinking, maybe I should collect some data. And then we have some saying, what is data? And that's okay. Different settings will have different drowning problems and levels of resources to tackle them. Some settings are going to benefit from active cooperation by many sectors, while others' progress will rely on a much smaller number of players. But one shared and common asset will always be the desire to act. So let's continue to hear from the other work groups today, and let's act. Thank you.
Erin, oh my gosh, you just dropped a lot of information on the whole group.
I know, and I talk so fast too, and I was so worried on our timing. So I have everything in transcript, so we could go through it in detail in our future sessions.
So yeah, Erin, you just gave us so much information, but it was so succinct and so good. And the conversations that this working group has had over the past couple of weeks has been so rich. So I'm going to encourage everybody to be thinking about these points. Come to the discussion. I think it's tomorrow. No, yeah, data in public health is 1 p.m. tomorrow.
Yes.
And we'll flush some of this out. Something just right off the bat, Dr. Simonian was commenting that even if we decide on the best standard for data collection, how can we influence local communities to adopt those sorts of standards? And yeah, great question. I think that that's something that we're going to have to figure out. So Matthew, how are we doing on time?
We have a few moments here. If anyone wanted to raise their hand or make an additional comment or question via Q&A or the chat.
Okay, so does anybody, if somebody wants to make a comment, please raise your hand. And then there's lots of positive info coming in on the chat. Mary Jo points out quite appropriately that this has to be funded, right? And that is something that the working group has talked a little bit about is, yeah, we all want better data, but it takes people and it takes money. Mary is saying that the barrier group needs data, right? And so hopefully we'll hear a little bit more from those working in that space about what types of data would be helpful to you, right? And I think this is where the real brilliance of these work groups overlapping can coalesce, because if the working group for barriers says, hey, we need to know XYZ, then great. We can incorporate that on the data working group as something develops for paramedics or police officers or, whatever else comes out. So any other comments or questions coming through?
Let me just thank you, for this opportunity, but we need to continue this conversation. So we'll see you tomorrow. I cannot present the same thing next week. We need that input.
Yeah. Okay. Doesn't look like we've got any comments tomorrow in the barriers, or excuse me, in the data. Oh, we do have, Mary, never mind. When we're in the meeting tomorrow, yeah, we're going to be able to tease some of this out a little bit more. But just to recap, the dream ultimate goal is a drowning registry for the state. I mean, as a researcher, I've seen other countries, namely the UK, Australia, New Zealand, Canada, do incredible things with their data because they have that level of detail succinctly kind of managed in a registry. That is the dream. If we can get there, that would be great. But there's lots of things that we can do before that to improve what we're doing and how we're doing it. So without further questions, Aaron, thank you so much. Matthew, anything to add here?
Nothing to add other than to tee up our friend Pete DeQuincy to lead us through the supervision and lifeguards.
Okay, so I'm gonna get Pete. Hang on.
Thank you, Aaron.
All right, Pete, you should be able to now double check. Pete, you should be able to turn your camera on.
And again, we'll do 10 minutes of report out and then 8 minutes of discussion.
Okay, excellent. Pete, as you're going, would you start off with a quick introduction? And then for everybody else, let's get that chat going.
Yeah,
Thanks,
yeah, so I can start. Let's do this. Okay. Good afternoon. I'm Pete DeQuincy. I'm the Lifeguard Service Manager here at East Bay Regional Park District up in the San Francisco Bay Area. And I have the honor and privilege to be the chair for the Supervision Lifeguarding work group. So can we just start going right into it, Will?
Yes, please.
Excellent. All right. So some of the initial things that we found with our group is that there is a gap specifically of an unawareness specifically on what it means for parental supervision and also what it means for swimming near a lifeguard. Again, not only there is an unawareness, but the people's context of what that means could differ dramatically. And I'm going to go through the gaps first and then go to goals and actions. Along with that, we also found that people are unaware where to find water safety information. One of the challenges is one advocate can say one place, another advocate can say another agency, and so forth. So again, water information, water safety information specifically is spread out, and where do you find it? So we'll talk about what we thought we should do. And our last gap here that we wanted to bring forward is there's a lack of standard preventions when it comes to the shortage and also the shortage of lifeguards. So lack of standard preventions could be both what's being done at the HOA pools, the hotel pools, and also personal pools and agencies all across. So there's a lack of standards. And I can bring in an example later on. My apologies, I'm a little bit nervous. It's a big group, unseen, have no idea who you are. All right, so when we're talking about the goals, we really want to educate the public on what supervision means and what a lifeguard means. Again, there's a lot of context, a lot of versions. Again, one of the failures that we have within the industry is that the strongest messaging of what a lifeguard is really comes from television. And because of that, that necessarily isn't accurate of what we do, both for the ocean guard, the lake guard, the pool guard, the local guard that is at your YMCA or at your swim school or any of those things. So again, how do we address that? Educate the public on what that person is, who that water safety individual, that lifeguard. We also really want to connect with the public on those resources. Again, there's a lot of great resources out there. And the work group found that instead of us trying to create something or build something new, why can't we start to facilitate and connect people to the great resources that are already existing? And that could be through the American Red Cross. It could be through all sorts of drowning prevention foundations, along with a number of things just governmentally through public health. And then the last goal is train more lifeguards through existing programs, develop programs within high schools themselves and community colleges. I've heard the discussion being brought up specifically that PE credit should be done. I've also heard the fact that the idea that us going in as subject matter experts might need to have a stronger touch or a longer extension of our presence within the high schools to really be more effective in helping that big transition. So instead of maybe a job fair or a 2-week window, but maybe something that's on a quarter or a semester length or ongoing. So let's talk about some of the actions and do the takeaway. I just got to remove something that's covering my view real quick. All right. We want to identify the agencies, and this goes back to the first one of the great definitions of what a lifeguard or swim near a lifeguard. We want to identify the agencies and resources to provide those definitions for parental supervision and support the idea that swimming near a lifeguard is what you should be doing, be all end all. I mean, that should be the priority. The other action when we're looking about when people are unaware to find water safety information, we're going to kind of go back to what water competency was talking about with the creation of a hub, a place that hosts all that information. It's easy accessible. The public can be directed towards that specifically. And we want to make sure not only is the information about lifeguards and parental supervision, there's resources there that talk about water safety programs that are in existence, water safety programs that are local, and also water safety programs that are probably being done out of state as well, so that we can all move in that direction. All right. The other thing is we want to distribute and we want to make sure that signage specifically at pools is updated. A lot of times what we were seeing is that there's a disconnect in the information that is legally required to be posted at a hotel pool, as opposed to what is currently being done, let's say in CPR class, in regards to, as they call mouth-to-mouth resuscitation or providing ventilations. Again, that's not necessarily something you'll see in a layperson CPR class. So again, thinking about what we need to do to update that signage and make it more relevant for the situation at hand. And then lastly, what we had here for the actions is develop stronger messaging on what it is to be a lifeguard. Again, I think everyone's doing a great job at getting lifeguard, but sometimes I think what we're seeing is, does the lifeguard or the image of the lifeguard reflect someone within that community? And maybe it's, it has to really do with that diversity, equity, and inclusion. Does that person represent a lifeguard, or can that person imagine themselves either a big brother or big sister as a lifeguard, and then themselves as it? So again, how do we talk about that messaging of what a lifeguard is and who they should be? And again, Will, that's kind of how I had in regards to the stuff. I kept it keeping it short and sweet to the point. Is there any questions and answers that I could quickly address? Do we have the time?
Beautifully done, Pete. Thank you for that. And we're right on time, right on schedule. So appreciate that. Let's take a look. Will, you're welcome to join in and take a look at some of the comments and questions and see if there's an opportunity for Pete or his team members to respond. I'm seeing this question from Phyllis. How about talking about the supervisor and the individual who's being supervised? Create a grid. Parents supervising 2-year-old versus 8-year-old with ASD versus with dementia. Competencies of supervisor required? Question mark.
Yeah, I think that's a great question. I know that there is a supervision matrix done by the Department of Army in regards to childcare that I believe that we could probably steal from them a little bit, that has that breakdown very specifically on age range, and then specifically on activities, like what can be done with supervision, without supervision, and so forth. I think if we adopted something similar, I think we could get a lot of push out of that and it would be extremely helpful to parents and supervisors and children. I know that one of the things that I've really appreciated with this group and just listening is that there is this push for supervision. There is this push to educate. I'm wondering if one of the unidentified gaps that we aren't thinking about is the role of the 5-year-old in supervising and educating the adult on what the 5-year-old needs. So, I mean, that's just coming from what I'm hearing from this group. So
you hit something on the head in that, you know, there's a lot of this material is already out there and we don't need to come up with something new. Julie is asking in the chat in the question, you know, what, and this was to your point, one of the gaps is what is parental supervision? Like, is there a generally accepted definition? And that's why I think this group is quite interesting, because we have parent supervision on one piece paired with lifeguards, ocean and pool and the other. And I think wrapping that question, Julie, into one large conversation about what does supervision by a lifeguard, by a pool, you know, by a grandparent, by a babysitter, by, like, I think defining those in those different lanes, I think is really helpful, and something that I think that we can start to think about with this group in the conversation. So the lifeguard and supervision group is meeting on Thursday at 10 a.m. Thursday at 10 a.m. And it is a really important discussion, and I think something that is new for those of us who's working traditionally in child safety of what is parent supervision, water watching, etc., paired with the pool and the ocean lifeguards. And there's some really good synergy that's coming out of that. So Pete, we are going to move on to the next group. Is there any final comments or remarks?
You know, the only thing, Will, is we really love everyone's participation. We'd love to have you on Thursday. Again, more experts, more perspective, points of view really helps enrich the discussion and takes us to places we'd have never thought of. So thank you, Will.
Okay, amazing. Thank you, Pete. Okay, Melissa, we are going to jump into life jackets. Let's see. I'm going to go ahead and find Melissa. All right, Melissa is now joined. You can turn your mic on and unmute yourself. This was another, hey, this was another really interesting group. And I think more than any other, the diversity of what we have in the state was on full display here. So Melissa, would you introduce yourself and then take us through what discussions this working group has had over the past couple of weeks?
Absolutely. Thank you. And thank you guys so much for having me. So I'm Melissa Miranda, and I am the Boating Education Outreach Manager for California State Parks and the Interpretation and Education Division, and supporting the Division of Boating and Waterways. So it's kind of a lot and a lot of mouthful of everything, but that's kind of where I'm coming from. And it's been so interesting already to hear about the other work groups and kind of the overlap that we already have, and some other interesting things that have come up in my world, legislation wise and stuff, that have kind of like cued my brain, specifically from our last presentation. So that'll be interesting to see how we all move forward. So if you want to go to the next slide, I'm going to do things just a smidge bit differently, because I like to be different. So I'm going to do gaps, goals, and actions for each of these 3 items. These aren't the only 3 things that we covered in our group, but I kind of felt that these combined all of the different topics that we've talked about over the last 3 sessions. And gosh, we could have had so many more sessions, but I'm looking forward to more input too from other interested areas. So the first gap that we identified is a lack of consistent and inclusive safety messaging throughout the state. This doesn't seem like a new trend, considering information from the other groups. And so some of our goals messaging for the third time. Yep. Definitely a huge gap for the state, and I would probably argue nationwide. So, so our goals for this gap would be to create compelling, consistent messaging campaigns with information available in multiple languages that can be easily adopted by various agencies. So we talked a lot about inclusive safety messaging. So not just something that reads maybe to you and me, but to be able to include other languages and have this relevant information to all of our wonderful diversity here in California. And so this is probably, is this the third time too, for a suite of tools essentially to be made available to partners. And I said, including manufacturers and at the point of sale. I can get into that in just a minute, but basically like a hub, like you guys were talking about earlier too, just an area where there's information that's made available and that's consistent, that people can go to trust that they're getting accurate, up-to-date information. And something that we talked about specifically on like the boating side, especially with non-motorized boats, with the crazy accessibility now, stand-up paddleboarding is really taken off. You can go buy those at Walmart, Costco. So any of those point of sale locations, and also at the manufacturer level, really getting that information to them. And I need to stop reading the chat. Sorry, I was getting distracted from that. But yeah, we want to have that information, consistent information from the manufacturers at the point of sale, so that people that are heading out on the water, maybe for the first time, because this is so accessible, they're going to be getting consistent information and being able to see what they need to do to help keep them safe out on the water. The next gap that we identified was a lack of access to life jackets at all waterways. And this could also be including pools. A lot of times life jackets are associated with boating. Specifically for what I do, I am heavily focused on boating. That's kind of where our funding and everything comes from. So we're heavily focused on open water, but life jackets at all waterways. So that could include pools. So some of our goals is to work with safety partners to purchase and distribute additional free life jackets. And before I get into actions, talking about life jacket loan stations, or being able to distribute life jackets. And just for a point of reference where we're at, so our agency is able to distribute between 5,000 and 7,000 to 8,000 life jackets a year, but that's not reaching everyone. And we have over 100 life jacket loan stations, but that's not reaching everyone. And back to the messaging, we don't have all messaging that is inclusive and meets everyone's language needs. So those are things that we kind of identified as gaps and goals for life jacket access. And then some of the actions for that we talked about, a barrier possibly would be agencies unable to participate in like a life jacket loan station because of legal reasons, meaning that they might feel prohibited from being able to provide the life jacket because they're not sure what the liability is. So we talked about finding a legal or academic partner to provide guidance on life jacket liability. And so once we're able to have hopefully a positive outcome from a study like that from a partner, we'd be able to provide that and say like, look, we've already done the research, the background on your liability for this. So there's really no reason you can't provide these free life jacket resources. So there's no excuse for people not having a life jacket. And then the final gap that we included in this, there's no requirement for boat or water recreation rental companies to provide safety information. And here in California, especially, but this is not unique to California, but we have just so many rental agencies, and there's not an overarching governing body. They don't answer to us with state parks or boating and waterways. It's all local jurisdiction. So one of the goals for this, we wanted to create buy-in from the rental companies and have them understand that we're the hub of information, and then being able to provide them with fact sheets and other collateral to be distributed to the rental agencies so that they can provide accurate safety information when they're renting out boating, any kind of water recreation activities out on the water. And so this would obviously help keep people safe that are unfamiliar with boating, because they could or could not be familiar if they're out renting a boat. There's various reasons people are out renting versus having their own if they're visiting or things like that. So we can get into all different aspects of that, but that's kind of just the highlights of where we were going with the rental agencies. It can grow arms and legs, and there's a lot of information on that. But even just being able to coalesce a full directory of the rental companies that we have here in California, that's not something that we have, and I'm not even sure where we would start with that. So that is what we have. Oh, and I did fill out the other slides. I'm not sure if we're continuing on with these. Yeah. So we have some special considerations for coastal, inland, and open and pools. I feel like those kind of all separated out. How are we doing on time?
You're good. We're good.
Okay.
We're good. Yeah, you can go through this slide.
Okay. I didn't want to keep rambling and be out of time. Okay, so there's special considerations for coastal because obviously that differs from inland waterways. If we're talking specifically about boating, that messaging is just very different anyway. It's a different type of boating. You're going to need a different type of life jacket if you're near shore or offshore. And then, so the inland open, we talked about the boating focused messaging, which is obviously, like I was mentioning, a different type of life jacket, a different type of messaging, different types of boating that's going to happen. And in pools, life jacket use at pools is not required, but it's a good place to learn the importance of the multiple layers of prevention. And then specifically for children, that's one of the only laws, unless you're talking specifically about boating, for life jackets. The children under 13 are required to wear a life jacket while on a moving vessel. And then there's special ordinances while recreating in or near waterways. I'm located here in Sacramento, and we do have a local ordinance here in Sacramento that requires anyone in or near the waterways to be wearing a life jacket if they're under 13. But then we talked about enforcement, and so that opens a whole nother can of worms for that. And then we talked about parents modeling life jacket use. So even when it's not required, the parents are going to be those, that the children are looking up to. I have a daughter myself and a son on the way, and I hate the thought that at 13, they become 14 and all of a sudden they're not going to wear their life jacket because they're not required to. So I want to be a good role model and wear my life jacket so that they also want to when they're not required to. And then populations of concern. Of course, we talked about the multilingual materials, and I, talked about that a little bit earlier about wanting to have equal access for all of our wonderful diversity here in California. And then I think I have one more slide. So for policy and legislation, we covered consider special local ordinances for in or near the water for children, like I was just talking about, education, messaging, education on life jackets, use near the water to the general public and across the safety community. Some programs and interventions, we talked about having a life jacket fit guide, signage, and protocols that would need to be in place. And that kind of relates back to our access and loan stations and all of that good stuff. Public awareness and marketing, we talked about having a resource kit, which was the hub kind of what we were talking about before. Everyone else has something special like that too for their groups. And of course, creating the multilingual messaging. And then data collection, we can always use more data and data. I don't, everybody says it different, but we'd like to consider linking the data available from public health and other collection agencies to better understand the trends of who is drowning and if a life jacket was in use. So that was a mouthful. That's what I have.
Terrific.
Yeah, I saw some stuff coming in the
Thank
chat.
you, Melissa, Miranda, and work group members. I just want to take stock of what's listed here in the chat and give you an opportunity, or some of your colleagues, to respond. So let's see. Mark Simonian, I found that the sale of flotation devices of all kinds happens at rivers and lakes where recreation goes on, and this doesn't seem to be regulated like you would find at major retail outlets.
This is a super important point, right? I know when I was doing parent education for Hoag Hospital in Newport Beach, I used to hold up like a Coast Guard approved life jacket right next to like a swim vest that you could buy at Walmart, Target, Costco. And they look the exact same, except one is not approved by the Coast Guard. So I think some education and messaging around, products would be potentially a really valuable use of this group's time.
I like that too. We've discussed, in our boating groups about at the point of sale, having that information available, but like, how do you reach out to all the big box stores and say, like, please don't market this as a life jacket? I think that's kind of similar to, sometimes you get car seats and they can sell things that aren't approved, and it unfortunately is just, this is a swim aid, not a Coast Guard approved life jacket. And so it's like, that goes back to consistent messaging and just really educating people on what the actual device that they need is.
And to that point on the what device do you need, there's several comments in here where there may be an overlap with parent supervision, talking about those pool floaties, the misconception that water wings, there's lots of different things that people put on their kids in the pool. And so moving forward with a discussion around some education around those different, for lack of a better term, floaties, I think would also be a valuable, would be valuable for this group to spend some time on. Melissa, have you, in your role, spent any time working with some of those other flotation devices?
Other than to show people what not to do, not to wear. When we do our life jacket trade-in events, Pete, I saw your comment about something similar, like a drive. We don't do life jacket drives, but we do life jacket trade-in events, which usually are just mostly life jacket giveaways, but that's how we coin it. Sometimes we get some of the flotation aids or the swim aids that people bring to us, and they're like, this pushed my kid down face first in the water. So like, exactly, it's not designated Coast Guard approved, so it's not supposed to flip you over. So but yeah, they're, other than what not to do, we haven't delved much into that in our boating messaging for that. But I've definitely seen some things on my ride-alongs that I've done with law enforcement. And it's not just the not Coast Guard approved, it's not wearing appropriate life jackets for the activity that you're participating in on the water as well, because there are different types of life jackets, different levels of flotation. There's a new life jacket label from the Coast Guard. We could get, I could talk about life jackets all day, but yeah, there's just lots of information on it.
Want to open it up if Rick or Sandy or others who've been part of this conversation have any comments, you can raise your hand and add on to this conversation. But there's some really rich things coming out in the chat that I think will probably come out in our discussion in our focus group session on life jackets. One of the things I would like to draw attention to is a comment by Dr. Wirtz, who said, in terms of diversity, language is not enough. And it's really important that whatever messaging is going out also needs to consider the historical, social, and cultural, components of that sort of communication. And there is actually some good evidence in this space. The folks in Seattle, Tizzy, who was on earlier, they've done a lot of work on life jackets with their Chinese and Vietnamese speaking population in Seattle. And so there's a lot of lessons to learn from those spaces as well. But Dr. Wertz, I'd like to, just thank you for that comment.
And that's definitely something we covered very briefly in our work group. We talked about some of the from shore drownings, unfortunately, and some of the cultural differences, and then ways that we can reach those audiences as well. So I definitely appreciate that. Thank you.
Excellent. So Steve Wertz, this no particular order for diversity, not enough to just have language, consider historical, social, and cultural issues.
Right. Most definitely.
Let's see, toss in from Dr. Agron, toss in misperceptions of pool toys, floaties.
Yeah. That's a big one. If you're transferring that to open water as well, that's a big can of worms you're opening. Also, pool toys as boats. So people taking pool toys down the river and then not having a life jacket. Not understanding that they're actually considered a vessel if they're bringing a paddle with them and they're on a pool toy that pops and they don't have a life jacket and then they drown. There's just a lot of things that people don't think about and just think they're going to have a fun time on the water. So
there are some like mega floats that happen in California down the Kern, and like in Laughlin, like the Bullhead River, is a pretty wild time. But there's these specialized events where loads of people will bring blow up mattresses and lots of blow up floaty things with a bunch of booze and then float down the river, right? So some strategic messaging around that would be helpful.
The raft ups. We found that those happened after they started doing dry holidays. And so this was their to get back at lawmakers, law enforcement. But then those people aren't the ones understanding they're taking resources away on other weekends that are vital to the rest of the population too.
So it seems like with the life jackets, Melissa, there's definitely a crossover conversation that needs to happen with the supervision crew around supervision and life jackets and floaties, parents, backyard pools, like that sort of thing. But there's also, I wonder if there's a conversation to also be had with the water competency and the swim lesson group, because one of the water competency components defined by the American Red Cross is, I'm pretty sure, Nicole, Pete, keep me honest here, but I'm pretty sure there is a life jacket one in there. And so one question to the swim lesson crew is, as you go through some of these water competencies, are you teaching children how to fit a life jacket? Are you teaching parents how to fit a life jacket? I know Pete has done some really forward-thinking work in Oakland with his swim lessons, getting kids to fit their own life jackets and jump into water and stuff. But I wonder if there's a crossover conversation also to be had there.
Totally. And that brings up another good point of not just satisfying the requirement of having a life jacket, but having a properly fitted life jacket. So we see a lot of kids in adult jackets and they don't understand if they end up in the water, that could very easily slip off. Or they put one in, one that's too small and the flotation isn't enough and doesn't keep them afloat. So there's just so many factors around life jackets, and it seems easy, but unfortunately it's, there's a lot of misinformation and or people just not educated on how to fit a life jacket. So that was kind of why we highlighted even just that rack card as something that's important in our toolbox. So
right. And something that Justin McHenry, chief of the California State Lifeguards, is bringing up is, that the regulation, a lot of regulations do exist around life jackets, and the enforcement of said regulation may be happening inconsistently, sporadically, in some places quite heavily. So partnering with our, park rangers that are working on lakes, or, our various harbor patrol law enforcement agencies in this is super important. I think the other important thing that came up in the conversation was modeling, right? And you spoke a little bit about modeling and how important it is that parents are wearing life jackets, but there is good evidence out there that says if a parent is wearing the life jacket, when that tween becomes a teen, they are much, much more likely to continue wearing that life jacket, especially in small crafts like canoes, kayaks, that sort of thing.
Absolutely.
Another crossover conversation that Sandy Needle is bringing up, and this is something that I'd like the ocean lifeguards to be thinking about and kind of preparing your mind for this conversation that's coming, is life jackets being worn by children at coastal beaches. And in some places, lifeguards are not allowing this to occur. And so I think there's a lot to dig into there around the use of a life jacket in a coastal environment. And so I'd be really interested to hear some of the expertise from the ocean lifeguard and the surf lifeguard crews on that perspective as well.
Very interesting.
Yeah. Okay, Matthew, I think we are just about wrapping up. The life jacket group is going to have a focused discussion on Wednesday, that's tomorrow, at 11:30. So come join us there to dig into some of these issues a little further. Melissa, any parting thoughts or comments?
No, just thank you so much for the great discussion and a lot of comments. Hi, Jen. Wow. Yeah, lots. So hopefully you guys join us tomorrow and we can continue this discussion, because obviously there's a lot of information and a lot of new ideas. So excited to talk to you all.
Thank you, Melissa.
And thank you to my work group. You guys are awesome.
Fantastic. Thank you, Melissa. And thanks everyone for such a rich discussion. Wow. Lots of really good comments and questions. I think we're at the point now where we can take a break and then we can resume at 2:45. So have a little bit of a longer break than planned, unless folks want to come back earlier, where we're basically there. So let's plan to come back at 2:45. And at that point, we'll be hearing from Barriers, that's Marcia Kerr and Marianne Downing, and then structure and governance for the coalition discussion will be led by Julie Lopiccolo.
We also have, sorry, Matthew, we also have rescue and CPR that is going to happen right after the break because we had to do that schedule switch.
There you go, rescue and CPR right after the break. So we'll see you all at 2:45.